How? What happened? This is high def gone wrong. So high def liposuction is when you're sculpting the fat underneath the skin so that you really kind of mimic the muscles that are underneath. And when done right, it's a beautiful way of accentuating what your natural anatomy is. But when people do it way too dramatically, meaning they just suck the hell out of the fat right along, let's say these are vertical athletic lines, but then leave a ton of fat everywhere else, it can be problematic. So how? She's the perfect example, because what happened is she had a super dramatic high def procedure where they sucked out everything in the vertical lines and probably left a lot of fat. And unfortunately, it looks like she may have gained a little weight since her procedure, and the fat that she gained is in exactly those areas that were left in the high def lipo procedure, and she has no more fat cells along those vertical lines, so it looks like she's got two sausages along the front of her abdomen, and it doesn't look really good. So I think a really important lesson is for us surgeons, when you do this procedure, you need to anticipate the changes that occur in people's lives.
Surgeries I regret having, part 1. I have had my boobs done twice, BBL, injections, cheek lift, brow lift, and there are a few of the surgeries that I regret. I regret the BBL because the fat transfer did not last. The liposuction was amazing, although it was painful. It was totally worth it. I have abs forever. I'm probably gonna have abs until I'm a grandma, but that I really, really like. Fat transfer did not last, so something they did not tell me is if you lose weight after, the fat will go away. So I lost 15 pounds after surgery, and my hips and butt, all the fat they moved completely went away. To get it back was something else that I'll talk about in part 2. That's my biggest regret out of everything I've done. Follow me for part 2.
Hey, Lonnie, you got your implants removed?
I did.
How long did you have them?
Okay, no, but let's talk about it, because I got my breast implants done 5 years ago, and I am booked to have an explant with breast lift next month. So a couple of months ago, I noticed that I was having this shooting pain in my neck. It was getting worse and worse as life was going on. And then eventually it ran down into my shoulder, and now it has evolved into my entire arm. My fingers are tingly. I have extreme brain fog. My eyes are extremely blurry. My right boob is burning. This one was confirmed ruptured, so I have a ruptured implant on this side. The doctors say that it's my anxiety and that a lot of scans can't show if an implant is actually ruptured or just like squeezed with scar tissue. So yeah, they've been playing me like I'm a dummy for a couple months. And also, I feel like I've been sick 5 times in the last 4 weeks, which I never get sick. So my immune system is slowly declining.
Come with me to get my cast off from my second rhinoplasty. I'm going to show you the pictures from my first one, which everything was fine except I developed a bump on the bridge of my nose, so they went back in to shave that bump down. That's why I had the second one. When I got there, I was super stuffy and miserable, and honestly, I could not wait to get this cast off. This is them taking it off. They used like a little oil thing that they put on, and then she like peeled it off of my nose, which didn't hurt at all. For what it's worth, it didn't hurt the first time either. And then they let me see my nose in the mirror for the first time, and it looked beautiful. The bump was gone. It looked gorgeous. But I still couldn't breathe through my nose. And then I found out the reason why was because I had stents in my nose, which I did not know. I didn't have those the first time, and they went ahead and pulled them out, which was really gross. I'm going to spare you the video of that. But just know it was such a relief, and it did not hurt. And then this is me looking a little bit happier. I still couldn't move my face, but it looks really good. I like to see the real life pictures of people's noses from like regular normal angles. So this is what my nose looks like now. It's still swollen, but I love it.
I'm 4 weeks post-op from a brachioplasty or arm lift, breast reduction, and back lipo. I just can't win with this mess. So my breathing is labored. I'm having back spasms today. I'm having the most insane back spasms, and I have a knot in my back. It's like this big, maybe this big. It hurts like a mother effer. I'm supposed to go to Mexico in the morning for a dear friend's vow renewal, and there's literally no way I can go anywhere in this amount of pain. My doctor called in, literally trying to talk, I'm in so much freaking pain. But my doctor called in a script for a muscle relaxer that I'm going to take as soon as my husband gets home with it. But I can't win with these surgeries from like random openings under my breast, under my armpit. I have so much regret from doing this. Like, I was doing so well with just working out and eating right. And then I did this stupid shit. And now I'm so miserable. I almost forgot. And I have a fever. It's a low grade. It's 100.4. But what the hell? What the hell? And then I'm not like, so I booked my travel. I always book through my Amex because I have like an Amex Platinum. So I always book through that. But I'm like, am I going to be able to get any money back? Just had a spasm. This really, really sucks.
I've had 2 nose jobs, 2 lip lifts, my teeth done twice. I've had 2 rounds of fat grafting into my face. I've had an endoscopic brow lift, I've had an upper bleph, and I've had my implants also done twice. All of that together, plus all the filler and Botox that I have gotten in my life, amounts to well over 100K. I'm 30 years old, and I get asked all the time, how the hell did I pay for this? So first things first, I definitely was suffering from BD in my early 20s when I got my first nose job. That mental illness drove me to not take no for an answer. I would have did anything to find a solution to my problems. There was a will. I was finding a way. It was my main priority. I worked as a dog nanny, administrative assistant. I bussed tables. I worked at Olympia Sports. I was in my influencer era, and I eventually turned to SW. There was not one specific job that afforded me all of the surgery. It was sheer will. It was driven by mental illness.
The plastic surgery is shaking, and this is a very serious story coming out of Atlanta, Georgia. A young lady got plastic surgery on her eyes and just supposed to be a little facelift. Well, she ended up getting basically disfigured. There's a lot to the story. Let's talk about it. Pictured above is Kayla Cannon. Kayla Cannon is 29 years old, and since the age of 9, she's been getting surgeries on her eyes. Now, she's born with a birth defect to where she has no muscles under her eyes. She went to the Oculus Plastic Surgeon Center in Atlanta, Georgia, and saw a guy that they call the Eye Guy, Dr. Chip Cole. Now, this is Dr. Cole pictured above. I'm going to show more pictures of him and give you more information on him. But something that I think is very interesting about him is he is a plastic surgeon, but I don't think he's specifically trained to do these type of surgeries. And that's a situation they keep having in Atlanta. Somebody's a foot doctor and they in there doing teeth. You see what I'm saying? And I think that this man is facing a lot more lawsuits. They're flooding in because he's allegedly disfiguring a lot of people. This other lady, she decided not to give her name or her information, but they said that she went to Chip getting a facelift from him. And that's what I'm saying. Are you the eye guy, the facelift guy, the nose job guy, the cheek guy? Who are you? Now, Kayla is in recovery, but during her procedure, she ended up getting an infection in her eye and an infection in her cheek. He kept going back and said that he would fix it. He actually tightened her eyelid too tight. And when she said it was too tight and it was pulling, it was not correct, he said, I'll fix it, I'll fix it. Enough with the fix it. You're botching these people. So I dug a little deeper and I said, Chrissy, get into some deep research about this guy. And I started finding different health journals. He was even on Business Insider talking about this laser clear laser treatment. And it says occupational plastic surgeon Dr. Chip Cole discusses the ultra clear. Let's dig deeper into that. And I'm digging deeper because reading on this ultra clear showed me what this man is really there for. Money. He doesn't care about health. Let's read. Even better, you can head straight back to work or play after getting the laser clear surgery because there's no downtime at all. Does that sound right for a surgery? The recovery period is extremely brief, which makes it an ideal treatment to be done as a 3 to 5 session series for optimal results and continued maintenance. Occupational plastic surgeon Dr. Chip Cole explained during an exclusive interview with Health Digest. And somebody that's doing their research will go online and say, Health Digest, that sounds like a reputable source to find out if this guy's legit or not. Many people, and I'm going to continue to read, many people receive only one treatment to obtain a glow for the weekend or a special event for the near future. While you may be able to go back and living your life after ultra clear trademark laser treatment, there's still a few things that Dr. Cole advises patients not to do. Now, this bothered me because it's giving me Ozempic vibes. You know, when these people, they do these ultra clear trademarks, they get kickbacks from these companies. And later you find out that it wasn't real. It was really opiates. Now everybody's on Oxycontin and, you know, the companies were getting a kickback from the doctors and it's all a scam. Now, I'm going to say allegedly because I don't want to get sued, but he's got a lot of lawsuits coming. A lot more people they might be ashamed to drop their pictures, but these ladies were brave enough. They were brave enough to show their faces and say, look what this monster did to me. He's not the daggone eye guy. He doesn't need to be doing surgeries on anybody. Now, y'all see what I told y'all. His page is still up if you want to leave reviews. I suggest you should leave them if you've gone through something with Dr. Chip Cole.
Yes! 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 No! 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 Fuck! Shit!
Nothing upsets my spirit more than seeing a pretty girl playing with her face. Because what are you doing? You already won the genetic lottery. You were naturally beautiful. Why would you go and let a doctor play with your face? It doesn't make sense. Now you out here somewhere looking like handsome Squidward. Now you out here with a Whoville nose. You got these lips that look like a blow-up doll from all these lip fillers. Like, you getting all these fillers in your face and all this kind of stuff, and now you got pillow face, right? You're doing too much, and it don't need to be done in the first place. Social media is really causing some of y'all to have mental problems to the point that you're looking in the mirror and you're seeing flaws that don't exist. You're going to fix things that don't need fixing. And it's scary. It's truly scary to see somebody who is naturally a beautiful person think that there's something that needs to be fixed. And I know this is all personal and, you know, only somebody can say what need to be fixed and not need to be fixed. But it's very sad to watch. It's very sad to watch naturally pretty girls mess their face up.
If you ever think you need Botox, you don't. You really, really don't, especially if you don't have a game plan and you just ask the person injecting you for their recommendations and you think it's normal to get Botox like it's getting a new pair of nails because everyone in LA has Botox and every influencer and every celebrity you see has Botox. You don't need it! You don't need it! You don't need it because one of my eyes is smaller than the other eye. That's not even the worst part. The worst part is I can only smile from this side of my face. This side doesn't move. I actually can't feel my face at all on this side when I drink out of a straw. That's what I look like. I can't make half the facial reactions I used to be able to make. And I kind of hate it. Actually, I really hate it. And I don't recognize myself in the mirror. So, yeah, I just like wanted to not get wrinkles, which I don't even realize why I really care about that anymore because I'll take wrinkles over a different freaking face. I've never made that face in my life before. That was actually a first. Oh my god, I'm scared. Oh my god, I think I might cry. Oh my god. Oh my god. It's not gonna go away for like 4 months. It's fine. It's fine. It doesn't matter because I'm hot on the inside and that's what matters. So, to be honest, all this was a learning lesson to save money in my bank account and that I like the way you look. That I like the way I look. It just took me losing money to realize that. So I guess lesson well learned.
Also, I got my breasts done before Stormy. Within 6 months of like having Stormy, not thinking I would like have a child when I was 20. Like they were still healing and I had beautiful breasts, like natural tits.
Sat perfectly.
Just gorgeous. Like perfect size, perfect everything. Like okay. And I just wish, obviously, I never got them done to begin with. I would recommend any one who is thinking about it to wait until after children.
Beautiful Kylie Jenner recently revealed her breast implant and surgery information for everybody. But what does this mean? I'm a real plastic surgeon. Let me explain. Kylie has a 445cc implant, and that's basically the size of this one. And this is a big implant. The average implant size I use is closer to 325 to 350 cc's. So these are big, like they give most patients a D or a double D cup. Her implant is a moderate profile, and that means that it's a bit of a wider, flatter implant than a high profile implant. These two implants are the same size, but you can see that the high profile implant's a little bit rounder and more narrow, and the moderate profile is wider and flatter. So it's a little surprising to me because an implant that big, usually in a small frame like hers, you would go with a high profile implant so that the implant's not too wide on her chest. But obviously she looks amazing and she has a great plastic surgeon, so I wouldn't second guess that decision. And her implants are partially under the muscle, and so we will put them underneath the pectoralis major muscle. About half of it's underneath the muscle, the other half of it is not. And this lowers a risk of complications, specifically capsular contracture. I go over Kylie's surgery in a lot more detail on my latest podcast. I also discuss Salma Hayek's non-surgical facelift, the latest Botox alternative, whether filler truly migrates all over the face, and a lot more.
Regrets after surgery. How soon can you get a revision? So we never like to talk about this because it's uncomfortable, but listen, sometimes it happens. And the reality is you usually have to wait some period of time after an operation to get a revision. I'm not talking about, let's say, bleeding after surgery or something like that. I'm just saying you don't like the results, there's something off, you want to fix it. Why do you have to wait? Well, usually after surgery, there's a lot of swelling, there's a lot of inflammation, and to go back immediately after the operation and try to fix it, you're working in a field that is not really good to operate in because of all that inflammation. It's going to mess up your result, it's going to skew what things look like in the long run, and it's really going to mess up the healing. So we usually wait, I would say on average the number is at least 3 months for most things, and then we'll go back in. Of course, there are other circumstances, specific things, but in general, anytime you talk to a surgeon about usually anything, you're going to hear 3 months for a lot of stuff, and the inflammation is why. So there you go.
Another question that I have gotten many times is, do I have any regrets? I have a lot of them. And I'm going to tell you why. One of them, and I know you guys are going to be like, what? Is the BBL. I really wish I never did it. Because as soon as you gain weight, that's the first place your fat is going to go to. Well, for me. I'm not really a huge fan of a huge booty on me because my frame is not too big, but my weight does fluctuate. Like I can go from 160 to 189. I was 189 last year, but my butt got huge at one point to where I was kind of like, I don't like this. So I started to eat better and exercise, but it's mainly your eating. So I had to control my eating because this thing was getting really big. As of now, it's not too bad because you guys can't really see. It's not too bad because my eating is kind of pretty good right now, I can say. And I've been exercising, but if I don't, it's a wrap. This thing is real big and to me it looks unrealistic. Another thing I regret is getting lipo in my arms. Let me show you why. You see those 2 marks? Those are 2 lipo holes. At first, actually, this one was a keloid. But I've been going to the dermatologist and he's been injecting, I think, steroids in them. Yeah, I don't know. He's been injecting something in them to make them smaller. But yes, those are my 2 regrets. So lipo in your arms and a BBL. I personally recommend, if you already got like a cute little bump back there, just keep it. Like, you don't really need nothing too big. But if you got like a super, you know, flat butt and you just want something a little more voluptuous, yeah, go for it. Or whatever look you're going for. But for me, I regret it. It's cute now, but guess what? If I was to eat Wingstop for a month and pancakes every morning and drink, it's nasty to me. On me, it just looks too much. So yeah, talk to your doctor and see what they recommend, but those are my regrets.
Work I regret having done. First up, I regret getting a boob job. I had to get mine explanted, so I obviously don't regret that. But the boob job caused so many issues for me and I looked like a freak, honestly. My boobs were so good before. Next, I regret having filler in my cheeks. It has been a nightmare to get it removed. Like, it's taken so long and my face has looked quite botched in the process. I just simply did not need it. Next, I regret having my eyebrows tattooed on. Look, I literally have to like paint over them with concealer every single day because you can see the tattoo. I also regret having my lips tattooed on. Reason being is my lips have never been the same since. They are constantly cracking and chapped, and apparently that is like literally a symptom of getting lip blush done. Also regret getting Botox just because I never needed it. Like, I got it at like 20 years old, which is just so ridiculous. And I completely lost the emotion in my face. I remember when I was on Big Brother, I did so well, like on reality TV, because I feel like they were just capturing my expressions in everything that I did, as I was probably the only one that didn't have a frozen forehead. Not to say I won't be getting it when I'm older. I will definitely be getting it when I'm older. Next thing I regret is getting veneers. They're only on that tooth and that tooth, but if you can see with that, the discoloration keeps changing. Also, I didn't really do my research, so the guys that did it basically shaved my entire teeth off, and I just watched like Indy Clinton get hers put on. She didn't even have to shave her teeth. So like, what was I getting done that I'm basically missing my teeth there? Last thing that I regret is getting hair extensions for so long. I didn't realize that they were so damaging to your hair. Honestly, I was like, why does my hair not grow? I have them in now, so that's so hypocritical. But my hair is like so damaged. I wish I'd never got them in the first place. Anyway, I feel like I'm nearly back to normal. I've worked so hard to reverse everything. The tattoos are being removed, filler's gone, the boobs are out. I don't know, I'm feeling good.
So it's been a while since I've talked about this, but since it was just exactly the 1 year mark on February 28th, I wanted to talk about where I am now. So last year, February 28th, after 15 years of waiting, I got a tummy tuck. A little bit of backstory. I made several videos of this. I have it on a playlist, but a little bit of backstory. Like 15 years ago, I lost a lot of weight. I was on medication. It made me gain a lot of weight. I was like 19. I lost the weight when I was 21. And I kept it off ever since. Like, I worked out, ate healthy. I got, toned up. I built muscle. However, if you have had a major weight loss, a pregnancy, and your skin didn't bounce back, there's nothing you can do about that. You cannot work that out. You cannot eat right until it's gone. It's there. So I waited 15 years to get a tummy tuck. I got a breast lift at the same time, and it was botched. I don't want to say botched because that implies it's the surgeon's fault, and I really don't blame the surgeon. But regardless, I am left with a deformed stomach. 3 days post-op, I noticed discoloration along my incision line leading up to my belly button. Called my surgeon, went in immediately. It wound up being necrosis. So a part of my incision in the very, very front, the skin tissue and fat tissue died. I should also mention that I had lipo at the same time. So this is more of a complication when there's a tummy tuck and lipo involved. So what happened was it discolored. It turned into a giant black scab. When it started falling off, this is so gross. There was a tunnel, like a cavity in the wound that was like 2 inches deep. At the time, it was really teeny tiny. So I had to go back to my surgeon, and that's when they wanted to remove the necrotic tissue. So they removed it, and I was left with a gaping hole in the center of my incision that was 2 inches wide by about 2 inches deep, you know, inside my stomach. I had to every single day pack the hole, the stomach hole, with gauze that were soaked in a very strong antiseptic solution called Dakin solution. It's literally made out of bleach. There is literal bleach in it. It bleached my clothes, and it gave me a chemical burn because I had to put it in my wound every day and then tape over it. I was literally taping bleach to my stomach. So after about, I don't know, 3 months of that, it finally closed. It closed in like June. And then it was just a waiting game. I had to have a scar revision. It was not, you know, as invasive as a tummy tuck. It was done right in the office, local anesthetic. My stomach's still deformed. This whole thing stole everything from me. I worked really hard on my body and my mind to get to a place where I was happy with what I looked like. Even though I hated having stretch marks and loose skin, I was in good shape and I was happy, maybe for the first time in my life, with how my body looked. The tummy tuck was supposed to be like, this is my moment, right? That insecurity that I felt having those stretch marks and loose skin held me back in almost every aspect of my life. I felt like a walking catfish. Like, I only liked how my body looked in clothes. Having this happen after you've had such high hopes, even though I had my expectations in check, I knew this wasn't going to solve every problem. However, I also knew that it would help. It didn't. I feel awful. I miss the girl that I used to be before the surgery happened. I miss my old body. I feel like I'm in a stranger's body because, yeah, my stomach is kind of flat, but it's also deformed at the incision line. What people don't tell you about when you get lipo or tummy tuck in your stomach is that the fat doesn't go there, it goes to other areas. So I feel like a linebacker because my arms are so big now. I lost all of my motivation for working out because I was so severely depressed and terrified through this ordeal that I just didn't give a shit. And I also was scared to work out because I was scared for the wound. So I have mental health issues. I have OCD. I have ADHD. I am terrified of wounds. And this wound was the worst wound I've ever seen. And it was on my own body. It kept me in the house for so long that now I don't want to leave the house. It's not like I don't want to leave the house. I do, but I can't. My social anxiety is at an all-time high. I've never felt this way before. I cry every day because I miss who I used to be. I don't feel like the same person anymore. I underwent a transformation, not the kind that I wanted, not the physical transformation, not the butterfly. I am mentally forever changed from this experience. And I know down the line, I'll probably be able to look back and say, I'm so much stronger. I learned so much from this. But right now, I didn't want to learn this lesson. I didn't want this transformation. I just wanted to be happy and confident in my body. And now I am looking at having to do another scar revision. And this time I'm going to go back under because my breast lift didn't take. And I'm going to do an augmentation. I'm just letting more time go by so it can, you know, heal a little bit more to get the best result. If you are considering cosmetic surgery, please know that things can go wrong. There can be complications for healthy people. I'm a healthy person, like relatively speaking. I do have a chronic illness. I have chronic nausea and vomiting, unrelated whatsoever to the surgery, like to the complication. I did blood work. I did all the testing. It was fine. But complications can happen to healthy people. I was 36 when I had the surgery. I was a healthy 36-year-old woman who worked out, ate healthy. And I still had this complication. It happens to about 3% of people who get tummy tucks. I still don't know how to cope with this. I have like severe PTSD from the whole experience. I feel like a shell of the girl that I used to be. I feel like my eyes are soulless and my sparkle is gone. So like that surgery stole everything from me that I loved about myself, all to trade it in for the body that I wanted. And the irony is, again, like the irony is I miss my old body. And if I could go back in time and not get the surgery, I wouldn't have gotten the surgery. So yeah, that's where I'm at. And I wish I had a more positive outlook on this. I wish I had something, you know, more positive to say about this, but I don't.
Guys, I got botched. Like, I'm actually botched. Like, my surgery went wrong. And it wasn't even like a little bit wrong. It's gone hard. Oh my God. Oh my God. The thing that blows me is that out of all the surgeries I've had, my skin has never keloids. I've never got keloids before. All of a sudden, why have I now got keloids on my arms? I don't know how the hell I'm going to fix this. I don't even know where I'm going to go to, but my arms, I'm just botched. Like, I don't even have the energy to make this video. I can't even button up my top because I'm so sad. I have had literally multiple rounds of like surgery. I've had the BBL, I've done my nose, I've done so many things on my body multiple times. So I haven't like done my boobs once, I've done it multiple times, I've done my body multiple times, and I have never ever been botched until now. And the guys, when I tell you, like, it's messing me up. It's actually messing me up, bro. When I actually think about it, I'm like, I didn't really need the surgery. Like, why did I actually do that to myself? Like, it's so peak. It's actually so peak. You know, I tell you guys my business all the time. So if you guys want me to talk about all my other surgeries though, that have gone right and correctly, I will do that. If you want me to talk about like BBLs, boob jobs, nose jobs, all of that stuff, I will. But I don't know. Every time I talk about it here and there, people always cuss me. So I'm like, oh, maybe they don't even want to hear about it. But yes, I have been botched. I had a flipping arm lift. And when I sit back and I think about it, I'm like, I really didn't even need the arm lift. Like, my arms were actually okay. They were chunkier, but I didn't really need the arm lift. And now I'm stuck. Should I just insert the picture? Let me insert. I'm going to show you. And an arm lift is basically like, I had very big arms, but my top half is quite small because of like the surgeries I've done. So I like small top half, big bottom half. Like, I like big thighs, big bum, big calf. Like, I like that. But then I want my titties to be small. I want everything else at the top to be small. But my arms weren't the small that I wanted it to be small. So basically, I went to get an arm lift. I never ever thought about the scarring. When I think about it, I could have just gone gym. I could have just gone gym and gym would have given me the same result. So anyway, yeah, I went to Turkey and basically they did the arm lift. When I tell you, like, that guy slaughtered me, I was in a butcher's, bro. Like, that man treated my body like a butcher's. He literally just sliced my arms. My scarring goes all the way into my armpit. So when I was healing, my arms are literally raised like this. So let me give you an example. So your arm, imagine my arm is like this big. He cuts the fat, excess fat off, pulls both skins together and stitches the skin together. But when he cut all the way into my armpit. So like when I was sweating and all of that, I was sweating into my stitches. Like, it was, healing was crazy. And now I have like these 2 long cuts on my arm. When I tell you, like, I've been wearing long sleeve. It's stressing me out. Like, this is what I get, man. Yeah, guys, if you guys want to do an arm lift, don't do it, man. Don't even do it. It's a waste of time.
Yeah, so I got lipo on my lower abdomen. I'm not gonna lie to you guys, I 100% regret that procedure. I wish I wouldn't have gotten it. I think I was fairly newly postpartum and really insecure on my body. And so I wanted to do a quick fix, and I was able to get it done for free because it was at the salon, like the med spa I worked at as a nurse injector. But the scars it gave me were not worth it. And honestly, it helped a little bit above like my C-section scar, but my body did not become what it was until I found my like correct workout regimen for my body type. And my workout split right now is Monday, Wednesday, Fridays, Pilates, and then Tuesday, Thursday, I lift with David at the gym. Take the weekends off. You guys know I don't diet. I don't believe in dieting. I eat everything in moderation. But if I withhold like food from myself, I will binge and purge. And that's something I've had an issue with in the past. But anywho, I got lipo done. They didn't do 360 lipo. They went like through the top of my belly button downward a little bit, kind of above my C-section scar, and then a little bit on my flanks. But yeah, I'm not gonna lie, I wish I wouldn't have done it because I just, at that time, mental health wise and body image wise, I just wanted to look a certain way and I should have just waited. But when a free procedure is offered to you and you think it's gonna be amazing, you kind of just take it.
Regretting getting a nose job in that first week is totally normal because you can do all the research in the world, but nothing is really going to prepare you for just how uncomfortable you're going to be for especially those first few nights and just that first week when you've got the cast on. I mean, it's extremely difficult to breathe. You're going to need a humidifier. You're going to need some sort of salivating enzyme that you can spray on your mouth just to keep your mouth from being too dry. There's just going to be a lot of maintenance with changing your bandages frequently and a lot of bleeding. It's just a lot to do. And I mean, it's just a lot of pain and discomfort. And honestly, you probably aren't going to like how the nose looks at first. Most people don't. And it's just a long process to get to where you want to be. And I think it's not talked about enough that like that kind of regretful feeling is very, very normal. And it's kind of part of the process as your brain is processing, looking at your face and it being like totally different and like also not what you asked for. But just have confidence that over time, you will get the result, hopefully, if your surgeon's good, that you've been looking for. I mean, it took me so long for the swelling to get to a manageable place. And then now that it's at that manageable place, I'm really just waiting for my tip to drop so that it just looks like exactly what I wanted. I'm happy with mine so far. I'm 5 months post-op, but yeah, it is a journey and this is totally normal, but you might feel differently in a week, 2 weeks, a month.